Thank you all for being here today. Friends joining us in person and virtually, welcome. I'm Brumar Mukherjee, Chair of Michigan Biostatistics, and it's so wonderful to see many of you here. You get an extra round of applause. So, today is a very special day for our department and the University of Michigan School of Public Health. Today we celebrate the life and legacy of our dear colleague, mentor, and friend, Professor Rod Little, through presentation of the 2020 Rod Little Distinguished Lectureship Award. The agenda for this afternoon is going to be the following. I am going to take a few minutes to comment on the lectureship and introduce Professor Stuart. After her lecture and question and answer, Rod will present the award plaque and make a few comments. But before I begin, I would have to thank a few people who have made this event possible. And as you know, in the middle of the pandemic, carefully planning an event takes a real great deal of effort. And we are very, very fortunate to have an amazing staff in Michigan Biostatistics. Thank you all. They are listed here. As all of us know, Rod is a visionary scholar and leader who has shaped the research, training, education, ethos, and culture of this department for the last 28 years. When I was preparing my vision statement, when I was interviewing for the chair position here, I asked Rod about his vision, and he said he had none. But we as an academic family are so fortunate and really grateful to have him at Michigan. The Rod Little Lectureship was established in 2016 to honor a distinguished alumni of the department and or a stalwart who has made foundational contribution to the field of biostatistics. The award is supported by contribution from many friends and alumni of the department to whom we are deeply, deeply thankful. Professor Joel Greenhouse from the Carnegie Mellon University and our departmental alum was the first recipient of the inaugural Rod Little Lectureship in 2016. In 2018, the lectureship was presented to Professor Scott Ziger, another legendary statistician from the Johns Hopkins University and a close mentor of Dr. Stuart. It is my great honor and privilege to introduce the recipient of the 2020 Rod Little Lectureship, Professor Elizabeth Stuart, Bloomberg Professor of American Health, Professor of Mental Health, Biostatistics, Health Policy and Management, Vice Dean of Education at the Johns Hopkins University. Please join me in congratulating Professor Stuart on all her accomplishments. This is Liz's first work trip since the pandemic began, so she deserves a second round of applause. Professor Stuart has really had an illustrious career that I attempted to capture a glimpse of in this one single slide. Winner of the highest honors and accolades in research, teaching, leadership, and mentoring, Liz, like Rod, is a trailblazing and iconic ambassador of the Bloomberg School of Public Health and our profession, defining our values and our culture. Liz, like Rod, is one of the most thoughtful, creative, and elegant statisticians of our time. Her impact has been profound in statistics and beyond, in mental health, education, and political science. As I was reviewing her CV, two things struck me. One is that how she has established a stature and presence in multiple fields as showcased by her presence in diverse array of prestigious journal editorial boards, JASA, Psychometrica, American Journal of Political Science. She's also a very highly cited researcher with more than 30,000 citations to her credit. What is even more remarkable is that her highly cited, most cited papers are methods papers, where she is the key or sole author. Many of you know Liz for her seminal work on propensity methods and matching. I assign this second paper on this list in my course every year. I actually taught it this morning, and I'm always amazed and grateful for its clarity and rigor. Liz said that this was her third throwaway paper from her dissertation chapter, and this became a treasured gem in the literature. So dear graduate students in the audience, please hold on to that throwaway third chapter, write it up, and a good literature review paper can really make an impact, and submit it, publish it. I asked Liz to share her top 5 papers, and here is a glimpse. So the first paper she mentioned is a paper on generalizability, which really made people think about external validity and led to new ideas. The one on the right side is actually a substantive material paper where she is the first author, and that's very important for a statistician. And the middle one, which is about COVID-19 and school policies, and you'll hear her talk about that, is very close to her identity because as a parent and her research in education and statistics and policy, everything came together in this paper published in Science. And then there are 2 other papers. One is the throwaway paper that we talked about, and the other one is actually her favorite because this is the paper by her first graduate student. And that is another side of Liz, that she's an amazing educator and mentor, and she's an exemplary and generous mentor and educator, really, winning lots of awards in teaching and mentoring, but more importantly, inspiring the next generation of statisticians at Hopkins and beyond. I personally am very inspired by her, and a great friend to her junior colleagues and students. I strongly encourage you to read this interview with Liz Stuart by Sherry Rose, which is an amazing interview published in 2016, reflecting on Liz's life and her career. You will come away with a sense of profound admiration for Liz, the polymath, the traveler, the dreamer, the avid runner, the parent, the partner, and the multifaceted, kind human being. Let us put our hands together for Professor Elizabeth Stuart, a statistician extraordinaire who in her 2020 Rod Little Lectureship, presented in 2021, is urging us to think about the role of statistics and of statisticians in influencing policy. What better time for this topic than today? Thank you so much, Liz. Congratulations on the lectureship, and the floor is yours. And if you have questions after Liz's talk, those of you who are on Zoom, YouTube, please type them, and I will monitor the chat. Of course, we'll take in-room questions as well. Thank you, Liz. Welcome.
All right, thank you so much. What an amazing introduction, and I am so honored. This is certainly, in some ways, my dream first trip during the pandemic, is being here in Michigan with all of you. The department, the school, the university is, one of my favorite places, and just the people here and the energy is wonderful. So I'm so appreciative and so honored. Seeing the slides with Joel Greenhouse and then Scott as the previous recipients, and of course honoring Rod. This is such a meaningful award for me. This hadn't really come through so far, but I suddenly realized, so Joel Greenhouse, I don't really know very well, but he was one of the mentors on my K Award that led to the generalizability work, and because he had sort of thought some about external validity. And then Scott, of course, has been a mentor at Hopkins, and I feel like Rod has been sort of a surrogate uncle or something through my advisor, Don Rubin. And so just it's coming together, and again, I just feel so honored to be now recognized here. So really happy to be here. I also have been remembering back that when I was applying to Ph.D. programs, the first time I came to Ann Arbor was to visit Susan Murphy, who was trying to convince me to do a Ph.D. in statistics with her here. I decided not to, but certainly was tempting, and perhaps the path not taken. But really happy to be here. And so this talk is going to be, these sorts of talks are sometimes a little hard. I don't think there's a single formula on here, but I'm trying to take that 30,000 step view and provide some of my thoughts just from my 20 or so years in the field on sort of this interface of statistics and biostatistics and public health and public policy, with a focus on sort of population inference. So it's going to be a little bit of a hodgepodge of a couple examples, and then some kind of lessons that I've taken away from, but really hope that it prompts some thinking and discussion. Okay, so this is the ambitious outline. We'll see sort of how things go along. But I want to start out by kind of framing around this idea of estimating population causal effects. I realize actually this is also sort of not the opposite, but very complementary to Scott Zeger's Lectureship Award, I guess 3 years ago with the pandemic, because he was talking about personalized medicine and sort of optimizing treatments for individuals. Today, I'm kind of taking the other approach of how do we make decisions about populations and sort of think about inference for them. I'll touch on experimental design options, some non-experimental design options, combining these sorts of data, and then sort of conclusions and final thoughts. So the premise here is, again, that sort of for many public health and public policy purposes, we want to know about broad population effects of, say, risk factors, maybe lead exposure among kids growing up in Baltimore, maybe interventions, so for example, mask mandates within a community, or policy changes. And I'll have an example later of sort of gun control legislation. And again, sort of separate from personalized medicine, this isn't so much what works for whom, but rather what is the best decision for a population, with some recognition that there might be more, better impacts for some than for others, but where we're trying to make a population decision. So the causal question is, if we expose some well-defined group of people, some population, to some treatment, policy, exposure, what is sort of the average outcome compared to if we don't expose them to that, sort of if we don't implement the policy or they get sort of whatever they would have otherwise. This fits into a push towards what's called evidence-based policymaking, which has been a big push in the government for the past few years, and I think the pandemic has heightened this in both good and bad ways, and so I'll touch on that a little. And I think in public health, this is often sort of second nature. The whole point of public health is to be thinking about population health. But we aren't always super conscious or explicit about the populations of interest. And so as Bramar mentioned, with some of my work, some of it has been sort of trying to get people to think more about external validity, and I'll come back to that as we go along. As a bit of an aside, part of the motivation for this talk and the title of this talk is that I've often been frustrated as someone who has been motivated by this work since even undergrad. Sometimes I feel like other fields get a bigger seat at the table for this sort of evidence-based policy-making sorts of ideas, and in particular economists, political scientists, even sociologists. And I think statisticians aren't always sort of deeply engaged in these topics. So part of my goal here is to kind of motivate us and to think about what do statisticians have to contribute and how can we do that. So again, just to motivate kind of where I'm going with this, it's again this idea of internal and external validity. So this is probably familiar to everyone here, but in general, randomized trials give us what's called internal validity. So in a randomized experiment, we randomly assign who gets the intervention and who doesn't. And so that gives us an unbiased effect estimate for that sample, or for sort of a population that is represented by that sample. Sort of informally, any difference we see in outcomes between a treatment group and a control group must be due to the treatment because there's no other systematic differences between them. The randomization gives us that similarity. And again, this is known as internal validity, or there's sort of various names for it, but for now I'll call it internal validity. I think, again, one of the things that's motivated my work in the past 15 or so years is that a lot of the time in statistics and other fields, we implicitly prioritize internal validity. And we haven't, as fields, thought as carefully about external validity, with some exceptions, which I'll touch on. And what external validity cares about is, do the results from some trial sample carry over to relevant target populations? So we might care about the people in the trial, but we also care about people who might not have been represented. And again, like when we think about study designs, and when, if you ever see like rankings of study designs, which is a whole issue that I'm not going to touch on, internal validity is prioritized. People say a randomized trial is always better than a non-experimental study. What myself and some colleagues have been trying to push is this idea that that's not always true, that when we're interested in population average effects, it may be that a non-representative trial is sort of worse than a representative non-experimental study. And I give talks on that, and in fact, the last time I was here in Ann Arbor was a talk on that topic to biostats, so I'm not going to get into the details of that today. I'll touch on it, but hopefully some of you have that in the back of your head for some of those details. One thing that I think has been gratifying is that in recent years, there has been more attention to this, even in sort of the popular press. So at the bottom here, there's a New York Times story, we need to recruit more Black Americans in vaccine trials. And then on the right is a story about not enough women in clinical trials. And FDA in particular is starting to pay more attention to this and recognizing that many of our trials don't enroll populations that reflect the populations in which these treatments or interventions might actually be applied. You know, it's funny, so in preparing this, so again, I've been doing this work since, 2007, 6, let's say. And then, in preparing this lecture, I had the opportunity to go back and look at some of Rod's work, and of course came across this paper from 2000 where, I don't know if any of you have felt this, you go back and you read some of your advisors or other people's work from years and years ago and realize, they had the same idea years and years ago in this like elegant paragraph. And you think, oh, what do I have to add? So I wanted to just flag this, that this topic hadn't gotten a lot of attention, but certainly here and there you could see discussion of it. So by the way, if any of you haven't, this is Little and Rubin 2000, which is a really nice overview of causal inference. It's in the annual reviews of public health. Very clear fundamentals of causal inference. And have these nice quotes of sort of, and I'll get to this, the ideal design about a population would involve random selection of subjects and random allocation of treatments. So you get the external validity from a random sampling, and then the internal validity of random assignment. And it says, thus observational studies may involve random sampling of a target population, but not random allocation of treatments. And on the other hand, clinical trials involve random allocation of treatments, but rarely involve random selection of subjects. And then a few paragraphs down is discussion about this point about if you don't have random selection, you have to account for that selection process if you want to draw population inferences and sort of account for selection. So since 2000, there has been a growing set of research on this topic, but again, I was perhaps not surprised to go back and find, oh yeah, actually this was articulated quite nicely before, and since then it's been sort of just fleshed out a little bit more. So what I'm gonna talk about now for the next 40 minutes or so is how can we get the best of both worlds? That, again, for public health, public policy purposes, we really do want that internal validity and the external validity. So I'm going to sort of talk through some strategies for doing that. So first, experimental design options. And this actually builds exactly on that quote from Little and Rubin. There are some scenarios where you can randomly select individuals from a population and then randomly assign treatments to them. Before coming to Johns Hopkins, I worked at Mathematica Policy Research for a couple of years, and we carried out a couple of these sorts of trials where, for example, the Head Start Impact Study, well, actually I'll say Upward Bound because that's one I actually worked on. In the Upward Bound evaluation, there were upward bound sites around the country. We randomly selected sites to participate and then randomly assigned applicants to either get into the Upward Bound program or not. So what's amazing is the inferences drawn from that study allow you to make inferences about the national population of people applying to Upward Bound programs. Same thing for what's called the Head Start Impact Study, which is an early childhood intervention. I think this idea is underused. I think there are other contexts where it could be. So for example, a health system that has an electronic health record system and maybe is going to do a study of, I don't know, a ping for a provider to remind them to tell their patient to get a flu shot or something. That could be done in this sort of way, but we haven't had a history of sort of thinking about that. I think we tend to just take the sample we take for the trial and move forward. But I think that it could really benefit us as society to think more carefully about how we can select subjects in more representative ways. But again, this is not always super feasible. You kind of need that population frame. You need the ability to either require or encourage people to participate. So it's not always going to be feasible. So then what some fields are moving to is sort of trying to be representative. So in mental health, for example, there's been a big push towards what are called pragmatic or practical clinical trials. And there it's sort of like we're trying to be representative, but it's not in a formal way. So they might just make an effort to enroll small sites and large sites, or some sites in rural areas and some in urban areas. So it doesn't have the sort of statistical sampling underpinning, but there's at least an attempt to recruit people and sites that reflect the population of interest. And then I wanted to mention, and again, partly because I view one of my roles in our field as connecting different areas and bringing ideas from one field to another. And one thing that has been interesting is that the Department of Education is getting more serious about this topic. As a little aside on this, education over the past 20 years has really moved towards doing more randomized trials. But now they're starting to recognize, partly through work of myself and some colleagues, that the schools and school districts that participate in those trials are often very different from the districts that decisions end up getting made for using those trials. So this funding agency called the Institute of Education Sciences is now funding what they're calling strategic replication studies. And what I like about this is it's not just a replication for the sake of replicating, but they say you have to sort of vary something in a strategic way. So maybe there was one study that was done in Baltimore, and so now we're going to do a strategic replication in an area very different from Baltimore, and sort of justify why we think the intervention will still work, but why this might be a different enough context that we need to probe whether it does still work. And so the type is super tiny, but they say it will support systematic replication that vary one or more aspects of a previous study, for example, urbanicity, the population of learners, educators, or schools, and also sometimes features of the intervention itself. And again, I like this because it's a thoughtful approach to building out a body of evidence and sort of saying, look, I know that my first study wasn't representative, but now we can sort of look and probe a different part of the population and explore whether the results carry over. But much of my work has been in scenarios where we just can't randomize at all. And I think, again, this is in part a whole area of statistics that really, this idea of estimating population effects this can really benefit. Non-experimental studies can be a key tool for estimating population effects. And again, this is a little provocative, and I'm not getting into the details today. There's sort of more, we could get into sort of some math and statistics, but this sort of framing that a more representative non-experimental study may give us a better population effect estimate than a representative, than a non-representative trial. So again, sort of our trials often are non-representative. They might not be informing for the people we care about, and it may be that from an overall mean square error, overall bias perspective, that sort of a little trade-off of internal validity bias, but lower external validity bias will make sense. So let's talk through what some of these non-experimental options look like. So one field that I have gotten increasingly involved in, and honestly mostly motivated by some really great collaborators who I've had the privilege to work with, is policy evaluation. Often opioid policy, some mental health policy, as you saw in some of the papers Bramar mentioned, and also some gun policy, which we'll see. So probably, well, I don't know. It's an interesting area because there's this whole huge area of what's called difference in differences or comparative interrupted time series, which is incredibly common in economics, political science, those sorts of fields. Statistics hasn't really been super engaged in that content area, in that sort of methods area. So it's hard for me to know, kind of this audience, how much you all would know. But fundamentally, the idea is to use variation across space, so like states, and time, to estimate the effects of some policy change. So some places implement a mask mandate, some don't, and we can compare trends in those sorts of locations to estimate the effects of the mask mandate. This is an incredibly rapidly evolving research area. Traditionally, the sort of standard model here is what's called a two-way fixed effects model, where basically we'd fit a regression and we'd control for states and time, we'd have some interaction terms, and we'd sort of estimate an effect. What's really interesting is that in the past few years, there's a growing understanding of the limitations of that method, especially in cases where different states are implementing this policy at different times. As a bit of an aside, it's interesting to me as someone trained from a sort of very design-based, non-experimental studies perspective, it's not surprising to me that this leads to bias, because you're kind of just throwing everything at a regression model. Some of the time points are sort of post-exposure, some are pre. There's varying, it's a complicated causal longitudinal setting. So in some ways, again, not surprising. So what newer methods are doing is sort of being more thoughtful about time ordering. It's like what we all are taught to do in non-experimental studies, control for baseline things, look at outcomes after the exposure. So some of these methods are now trying to do that more carefully. I'm not going to get into more details on that, but it's a rapidly evolving area. What I'm going to do is go back in time and just motivate it using a fairly simple example with one state and just show an example of how these methods can impact policy and how we can sort of have a seat at that table in a sense. So again, and partly, I guess this talk is my opportunity to talk about the studies that have been most sort of meaningful for me to be involved in. So that's sort of what I'm doing. So this was a study which a former postdoc, Kara Rudolph, led on background checks for gun ownership. So, and what made this exciting to work on is that we published this paper in the American Journal of Public Health, and then a year later, President Obama announced some new executive actions around gun control, one of which was background checks, and he cited our paper in the motivation for these executive actions. Since then, I mean, our paper is not the only piece of evidence on this. Oops, I am not going to restart the computer. This built on a body of evidence. It wasn't like we were the only people that, sort of had shown this, but this one paper was sort of a nice, clear, clean example. So let's talk through what that was. So this question was looking at the effects of a law that Connecticut passed in 1995, which required a permit to purchase for someone to get a handgun. A permit to purchase law basically is almost more like a driver's license equivalent. So it involves a background check, fingerprints, and some safety training. So it's much more comprehensive than just a background check where kind of it's just a quick, does someone have a felony conviction or something? And so what we did here is we used data on homicide rates over time for Connecticut and for 39 states that consider sort of at risk for implementing such a law in 1995, i.e. didn't yet have one in place. And so again, fundamentally, we will compare trends over time in Connecticut with these other states. And I know some people in the department work on negative control ideas. And so what's nice here is this wasn't a super fancy version of that, but we're able to look at firearm homicides and non-firearm homicides with the assumption that sort of this law should impact the firearm homicides, but not the non-firearm. And again, this is sort of a clean example from this one paper, but I just want to highlight that these results are very consistent with a growing body of research on this topic, including Missouri actually repealed a similar law, and so you can look at sort of whether things went in the opposite direction in Missouri, which they did, and in studies that look at suicide in addition to homicides. So the approach that we used is what's called a synthetic control approach, which I'll have a nice picture in a second. But basically, you use the comparison states to sort of predict, I said guess here, but predict is probably a better term, to what would have happened in Connecticut had Connecticut not passed their law. This is going to work better if those comparison states are similar to Connecticut, and especially if they are similar in terms of their baseline homicide rates before the law was changed. So there's this approach called synthetic controls, which basically weights the other states to look like Connecticut in that pre-period. And again, sort of the assumption is that in that weighted comparison group, the trends in Connecticut would have evolved similarly over time had they not passed their law. I want to note that what I'm showing is a sort of very basic synthetic control approach. Again, this is an area where a few statisticians have started making some nice contributions. And in particular, Avi Feller and his student Eli Ben-Michael and Jesse Rothstein have extended this to what they call augmented synthetic controls, which leads to actually some nicer inferential properties and sort of builds an outcome model in addition to this weighting. We can talk more if people are curious. I think one thing that's important and a theme in a lot of this work, and I think when working in sort of public policy context, it's very useful to be transparent and data-driven. And one rationale here is that often these two-way fixed effects approaches, people might just pick one comparison state. So they might say, okay, I'm going to use data from Connecticut and I'm going to compare it to New York or Pennsylvania, but fairly ad hoc, kind of arbitrary. This weighting approach allows a data-driven sort of selection of comparison units using just the pre-period data. So not using outcomes, but sort of this design using the pre-period data. And this particular weighting approach guards against extrapolation. Sort of we can ensure the similarity of, in this case, Connecticut and the weighted comparison states. So this is the sort of result that you can do, and this is from the paper. So the solid line in each plot is Connecticut's homicide rates over time. On the left is firearm, and on the right is non-firearm. The dashed line at the top is all control states. So sort of unweighted, just if we ran just a basic regression, we would essentially be using that line, sort of weighting each of the states equally. The dashed line that's closer to the solid line is the synthetic control. And you can see that we were able to better match these trends in the pre-period using these synthetic controls. And then what you do is you sort of project out into the post-period, And our estimated effect is basically the difference between what we see happening in Connecticut and what we predict would have happened had they not passed their law. For the statisticians in the room, the inference here, one of the reasons to do augmented synthetic controls is the inference here is a little weird because it involves like a permutation test. Like you don't get point estimates and confidence intervals, so it's a little clunky. The augmented synthetic control allows for an easier statistical inference to be made. And you can see here that the firearm homicide showed a large effect, non-firearm didn't. So that was sort of gave us some extra confidence that what we were seeing was related to the law. But again, for this audience especially, I want to highlight that there's a lot of methodological questions in these sorts of studies. So how do we weight different variables in that weighting? Sort of, do we use just the pre-period outcomes, or do we also try to weight on covariates? How do we use this approach when there are multiple intervention sites? Sort of, do you do it separately for each and then aggregate, or do you kind of make a conglomeration? I'm really interested in how do we formally combine results. So a colleague, Alex McCourt, again led some work with like the Connecticut data and Missouri homicides and suicides, and kind of he just ran them each separately and kind of made some conclusions. I think we could sort of unite them and come up with a more a better inferential framework for combining those different settings. There's also newer flexible modeling approaches, or some Bayesian methods that can be useful for these sort of time series models. Something I'm working on now, actually, with Nick Seawald, a graduate of the stat department here, who's now doing a postdoc with me, is sort of how do we best take advantage of individual level data sort of that might underlie these aggregate rates. If we have counties within Connecticut, how can we best use those? And then finally, I think in some ways the big issue here is that for many state policy evaluation studies, we only have 50 states. And so there are significant statistical power challenges and a lot of questions that policymakers want to have answered, but I'm not convinced we really actually have great data to do that. So how do we make the most of the data we have, but also respect the uncertainties that we also have? And so these are the sorts of questions that I think statisticians can play a huge role in answering. And just to motivate this a tiny bit more with COVID, I had to, of course, bring that in. These methods are being used all over the place right now. This literature search actually from the summer had 2,000 papers with like coronavirus and policy. There's like examples of like studying the effect of the Sturgis motorcycle rally on cases. There's shelter-in-place policies. There's all sorts of policy evaluations happening right now. Some with okay methods, some with not good methods. And I think we as statisticians have a role to play in helping people think that through. Okay, so any talk like this can't get away without talking about, quote, big data. So I also just want to highlight that we also have more and more sources of data on broad populations of interest. And we can use this data in non-experimental ways to estimate causal effects. But we have to account for the fact that we generally don't have randomization in these contexts. So this is, again, where design plays a key role, where we can use sort of a spirit of design where we try to set up clear comparisons of treatment and comparison units, where we have tried to adjust as well as possible for confounders. And again, in the spirit of sort of one of these sorts of lectures, which I think partly looks back to look forward, I just love this quote by Bill Cochran: "The planner of an observational study should always ask," he said himself, I will say themself, "how would the study be conducted if it were possible to do it by controlled experimentation?" So sort of think, how would I define exposure? When would I measure outcomes? Who would I enroll in the study? And really think that through carefully in order to design the study. So I'm going to be quick on this one, but just as an example of this design aspect, is we did a project looking at the effects of suicide prevention centers in Denmark. So Denmark, well, first, suicide is generally hard. Suicide prevention programs are difficult to study because you need huge samples and potentially very long follow-up. So we were able to use data from Denmark to look at the effects of some suicide prevention centers that they began rolling out in the early 1990s. So we were interested in asking, what is the effect of these centers on the people who go to them in terms of repeat suicide attempts and death up to 20 years later? And so this is the amazing Scandinavian registry data, where we had data on everyone in the country of Denmark, including their medical history, their psychiatric history, their job information, their family structure, and even their parents' psychiatric history and suicidal behaviors. So we had data on all individuals 10 and up for about 20 years. So a non-design-based approach would basically throw all this data into a regression and sort of say, okay, what's the difference in outcomes for people who go to these centers and who don't? That's not a great causal comparison. It doesn't anchor time. There's probably large differences between the people who do and don't go to these centers. So a design-based approach first says, who is our comparison people? So we say, okay, our treatment group is pretty clearly the 6,000 people who went to one of these centers. And they went after a suicide attempt. Our comparison group is those people who had a suicide attempt but didn't go to one of the centers. And in some ways that sounds obvious, like, of course we should select on people who had a suicide attempt, but often in these big data contexts, people forget about that sort of subset. You think, oh, more data is always better, but in fact we don't want to use the people without any suicidal, they're not eligible to go to one of these centers if they didn't have a suicide attempt. So step one is to pair our data to the people for whom they at least kind of could have gone to one of these. We then used propensity score matching to find 3 individuals for each of the people who went to one of the suicide centers who looked similar on a large set of background characteristics, again, including family history. And we can see how well this works, and this is one of the nice transparency aspects. We can show that this is a sort of on the x-axis is a measure of similarity of the treatment and control groups. So the blue hollow circles are before our matching. The red solid circles are after. And we can see that this matching made our groups closer to 0, i.e. more similar on this set of covariates. So we can compare outcomes in these groups with better control for these characteristics. And we can then, sort of almost treat it, like analyze the data as if it came from a randomized trial. It didn't, but we can analyze it and say, look at odds ratios for repeat suicide attempts. Importantly, although, and again, this is transparency, I think we as statisticians need to always be honest about our analyses and acknowledge that we can interpret this as a causal effect if there's no unobserved differences between these groups. And we can probe and say, well, if there was an unobserved difference, how much would it change our conclusions? And you can do these sensitivity analyses that sort of push that and say, well, an unobserved confounder would have to be this related to treatment and outcome to lead to, say, a non-significant result. And again, I think it's crucial for us as statisticians to help people think through the assumptions underlying these analyses and sort of probe how much would our results change if those assumptions aren't satisfied. And in this case, we were able to show that it was unlikely that there would be some, like the substantive experts were able to say, no, it's probably unlikely that such a strong unobserved confounder exists. Okay, so in a few minutes, I want to highlight this paper on COVID and schooling, because this was incredibly gratifying over the past 18 months or so. As a parent with kids who did not go to school at all in person last year, this was a huge debate of sort of the risks of in-person schooling in terms of COVID risks and huge trade-offs with sort of mental health and academics and COVID, a really complicated policy question. And at the time schools had to be making decisions, there was very little empirical data on this. And so it's sort of we're worried about COVID risk, so we're going to close schools, but we don't really know how much of a risk it is or how to prevent any risk. So I had gotten involved with a very large-scale Facebook platform-based survey called the COVID Trends and Impacts Survey. This survey is, the US version is run out of Carnegie Mellon by the Delphi Group, and then the University of Maryland runs an international version. If you have a Facebook page, it comes up at the top of your feed, so it's actually part of the Facebook. It's not like on the side as an ad. It's part of the feed, and it pops up and says, can you answer some questions about how you're feeling or something. So we worked with Facebook and, really with CMU, to add some questions on in-person schooling starting in late November, and then they've continued through now, late November 2020, and they continue now. And I want to highlight this. This is an important point, because what this data gives us is household level information on whether a household had a kid attending in-person school. And as a parent, I knew this was important because many districts had a decision made at the district level that said, like, school is open or closed, but individual families could sometimes make a different decision. So if a school was open in some districts, the parents could choose to still keep their kid home. So in order to look at sort of the household risk of in-person schooling, you really need this individual household data on who was actually going to school in person. And I think this is the only large-scale source of that household-level data. So we were able to use, we had this paper use data from late November to February of last year. And there were about 600,000 households with a kid in K through 12. And so what we had was the survey data on their in-person schooling experience, also on whether anyone in the household had tested positive in the past 2 weeks. And this was all linked to the county, so we also could link in county-level cases and county-level demographics. And so just some of the data, partly if any of you have kids in school, you might be interested. During this time window, about 50% of kids were in school in person. Panel B sort of shows that. The purple is more in person. So there's pretty big geographic variability. I was in this green area with almost no one. And we also were asking about full-time and part-time, and importantly, also about the mitigation strategies in place in the school. And I'll come back to this in a second. So we were able to compare households, again, with a kid in in-person school and without, controlling for a number of baseline characteristics. This doesn't use any propensity scores, sort of for simplicity, but since the appendix was intense and had like every possible permutation and included some propensity score adjusted analyses, everything was remarkably consistent, where we showed that in-person schooling, especially full-time in-person schooling, was associated with about an odds ratio of 1.38 for risk of COVID or COVID-like symptoms in the household. What's important, though, is that we also were able to show that that risk went down, and I'm not going to talk through the details of the figure, but that risk went down with more and more mitigation strategies in place. So we weren't really able to disentangle exactly which we sort of tried, which mitigation strategies, and we sort of were able to show that, for example, teacher masking, a symptom screen, and no extracurricular activities helped bring that risk back down to 1. So sort of, in some ways, what we all knew from the science and the biology, which is that in-person schooling is inherently risky. I mean, bringing people together, if you just don't have masks and everyone is just mixing, that's going to increase transmission. However, we can bring people together safely using masks, using symptom screening, etc. So again, I think consistent with what was known about the disease and the biology, but provided some empirical data to help really show what these associations looked like. So I think I said most of this. I want to also note that we actually have a paper under review right now, because the reviewers, of course, you do work. The reviews are like in May, June, and people are like, well, what about Delta? What about vaccinations? So we've actually we have a second version of the paper using data from February through June, and remarkably similar results again. Sort of same, yes, like even once people had vaccines and Delta was just starting to come, but these overall, which again makes sense, like the underlying biology kind of is still the same. Okay, but again, I think lots of methods questions here. How can we take best advantage? And this is a large-scale data set, and so sometimes, like, how do we think about efficiently doing a design-based approach in these complicated data structures? This might be a good thing to come back to in the Q&A. There's a hot debate, or Rod and I were talking about it earlier, about using, like, how representative, in fact, are these data? Xiaoli Meng and Bradley et al. Have a paper showing that the Facebook-based vaccination rates are quite different from CDC reported rates. And sort of he provocatively says that a 1,000-person random sample actually would be more accurate. I think what my takeaway here is that we have to remember, what are we trying to use the data for? And that in this case, we're looking at these associations and variables that are not available elsewhere. And so even if our overall prevalences or rates are maybe off, I think that we can still get good information about these associations, even if our sample isn't officially representative. But I think we as a field need to help contribute to these conversations, as is happening with some of these exchanges, to help think through the pros and cons of different data sources. Okay, I have 1 minute on this, and then I'll sort of wrap up. This is the topic that I spent an hour talking about the last time I was here in Michigan, so that's why I decided not to really touch on it today. But there is a growing body of research on how to combine randomized trial data and population data to basically project impacts seen in the trial to a population and account for this fact that the trial is not representative. There's two main analysis approaches here. One involves weighting, to sort of weight the trial to look like the population. The other is more of a model-based, so for example, Bayesian additive regression trees, where you flexibly model the outcome in the trial and then use that to project impacts in the population. One highlight I want to make here, and again, sort of I'm not focusing on it here because I talk about this a lot, including here. One thing, though, that's really important here is to do this. I think people want to do this. Every time I give a talk on this, people are like, oh, that's great, yes. The data is incredibly, often it's the data that's sort of the limiting factor. Because to do this well, you need to have the effect moderators measured in the trial and in the population data, and we are not very good at having consistent measures in these different sources. So that's a conversation for another time. So let me take a few minutes to try to give some overarching thoughts. So again, sort of in part, I want to have an aside on data, that if we want to be serious about population effects for public health, public policy, we need population data. I want to also say that big data is kind of popular right now. This stuff doesn't necessarily involve, quote, big data. That Connecticut study had 600 observations, 40 states' annual data. But underlying that needed reliable data on homicides from across the country. So sort of underlying that aggregate data, we needed that high-quality population data. And again, as I said a second ago, we, for generalizability of trials, often are incredibly limited in terms of our ability to combine data sets with consistent measures. But I think moving forward, there is a lot of hope for this sort of work and for explicit attention to populations of interest. We have more and more access to electronic health record systems. I was just learning today about some Michigan efforts in this area. There are some large administrative data sources like school system data. But again, we have to really make sure that the measures are comparable if we want to combine, and that the data is publicly available. And it's often harder to find this population data than you might I do think, though, and I wanted to really highlight this, it's particularly, I was sort of reflecting on giving this talk here, because I think actually Michigan might be among the best universities to be thinking about these topics. Because, with the Institute for Survey Research and the JPSM connections, like, Michigan has maybe one of the largest sets of survey kind of people who are serious about surveys and populations than almost any other university. So I do think that there's potential real opportunities here in particular to be thinking carefully about this. So I want to also, this is a kind of pivot, but again, sort of in reflecting on sort of my work, I really stumbled, and actually Bramar and I were talking about this. I stumbled into statistics and then public health and biostatistics. After college, I worked at Mathematica Policy Research as a research assistant, sort of discovered statistics and thought, oh, this is what I want to do. I went to Harvard for graduate school basically because when I was at Mathematica, I said, hey, Mathematica colleagues, what statisticians do you go to when you have questions about methods things? And the answer was Don Rubin, and he was about the only person they mentioned. And again, this gets back to my point that we as a field haven't been super engaged in this world, and I think that we should be more so. That said, Rod was another example of this, and in fact spent time at EPA, and I think there are some nice examples of statisticians who have straddled sort of government and policy and statistics. I did this a little bit, and I think this is how I first met Rod, was Harvard had a Census Bureau contract that helped students work on some census-related projects, and I did some of that with Alan Zaslavsky. And so you can sort of find these opportunities. Like, my point is, like, yes, I found my way to this world, but it was a little happenstance. And I would love for us as a field to kind of make it more obvious how people can find this place where you can work on statistical methods for public policy and sort of with this population focus. I meant to include it on the slide. I'm just realizing I forgot. On my webpage, I actually, a few years ago, put together a listing of what I'm calling social statistics programs, which are sort of statistics-based master's or Ph.D. programs, but where there's a sort of core emphasis on the social sciences and sort of policy implications. But we don't really even have a name for it. We have biostatistics. We don't really have a way for people to find their way to these fields. So it's one of the reasons I like to talk about it, is to sort of point out to students that there are some really interesting areas here, but right now you kind of have to find your way around. So again, to that point, just a couple final slides. I think we as statisticians do have an opportunity and an obligation to be engaged in these conversations. So I think we can help provide a structure and framework for the use of evidence and data in decision and policy making. And I think one thing that distinguishes us is, and this is when I realized I was a statistician and not, say, a political scientist, I care more about the methods than I do the answers. And I think that is a really important role for us to play, to sort of help people think about the rigor and quality of a study and focus on those aspects. And then sort of the substantive answers are interesting and important, but our focus is on the sort of statistical underpinnings. I think we can have a bigger role in teaching methods. The pandemic, I think Bramar has felt this too, the pandemic has been very gratifying. It's the first time in my career that reporters want to talk about non-experimental study designs. And I have really enjoyed that, and I think it would be great if we can figure out ways moving forward to continue to help the public, journalists, et cetera, understand some of these fairly basic sort of study design questions. And I think we need to be trained in scientific communication so that we can engage in those conversations. And we need to help our collaborators see our value. And I was on the review panel for the Department of Biostatistics in the spring, and I came away from that with a feeling that Michigan does a great job of that, of sort of deep collaborations and a deep appreciation for what statisticians have to offer. Unfortunately, that isn't the case everywhere, and so I think we have more work to do there. What do we have to offer? I think we as a field are really good at handling messy data and all of its complications. We often have more focus on things like measurement, sampling, how to handle non-random samples. We can develop new methods when needed. We don't always need to develop new methods, but we can if needed. And again, our sort of core is in this rigorous study design and analysis and sort of contributing to that. We also can bridge fields. Again, much of my career has been spent saying, hey, X field, this other field is already thinking about similar things. Can you maybe use some of those ideas? And I think, again, as this is preaching to the choir, sometimes people think, oh, but isn't big data going to solve all of this? Or isn't machine learning going to solve all of this? But of course, we all know it's not. And in fact, our role is probably going to be even more important. But what shouldn't we do? I want to say, and again, this is partly just my opportunity to spew my thoughts. I think we need to be careful not to be seen as the people who always say no or that studies are bad. I think we sometimes have a tendency to critique without offering solutions, and sort of finding that balance of critiquing, but in a way that doesn't sort of just say, forget it, you can't do anything. Providing overly complicated solutions that yield only minimal improvement. We need to, especially in these contexts, we need to sort of make it easy for people. Like the suicide example is nice because like that 3-to-1 matching, it's very easy to explain. It's sort of a very straightforward comparison. You can show the covariate balance. It's very sort of transparent and again, sort of easy to explain. I have a pet peeve about quibbling with each other over minor differences in methods. And I will say I think we sometimes have a challenge where we as a field grapple with something. P-values, exactly how to handle missing data, some of these questions about surveys. And we sometimes forget that sort of other fields are listening and watching. And for example, I have had people say to me, well, you guys don't seem to agree in exactly how to implement multiple imputation, and so I don't think I should do it at all. And I'm like, no. There's sort of core ideas that sort of are important and that we all agree on, or at least probably, and that we can sort of learn to help people understand like the core things versus sort of these like, oh, well, maybe this is slightly better than that. I actually think so Rod was a first author on a really nice paper on missing data in trials. And I think that's a great example of statisticians coming together to communicate these core ideas in ways that sort of cut through the debates and sort of give the overall, like, as a group of statisticians, here's what we recommend. And I think those can be incredibly powerful and important. But again, sort of maybe counter to my first one, I think we should be willing to speak out when we see poor study designs or analyses. I will say, for example, the American Journal of Public Health has a tendency to publish some very poor policy evaluations, like comparing states at one point in time with and without a policy, like no attempt to control for any sort of confounding. So when I see that, I write a letter to the editor and sort of try to push. And so I think, again, we need to be advocates for strong designs when we can. I will say one more quick note on the quibbling with each other. I was, 2 days ago, I was recording a session for the AAAS annual meeting with Karen Kafadar, and she actually made the same point, and she said she heard Bernard Silverman give a talk. And apparently he was giving a talk, and he made that point and sort of said at the end, he had a slide that just said, others are listening. And again, I think it's important for us to remember that when we can have scientific debates and conversations, but other fields are listening, and we have to be thoughtful about what messages we are communicating to them. So again, what do we have to gain? We can contribute to important public health and policy questions. There are really interesting statistical challenges. We can collaborate across many disciplines. And it's clear we're needed more than other. And again, one of the most gratifying parts of the past 18 months for me has been seeing statisticians like Brumhar, Natalie Dean, and others having a voice in public discussions about data and evidence and what do we need to inform public health and public policy. I think I've probably said everything here, so I'll just switch. I couldn't this is just a subset, mostly of current students, but huge acknowledgments. Don Rubin was my dissertation advisor, and looking back, I worked with Don and Gary King in political science and government, and Alan Zaslavsky in healthcare policy, and it was like a dream team for what I wanted to do, and just really amazing. And then I've sort of met people like Rod through those networks, and just had the amazing co-authors and students, and funding from various groups that has helped support this sort of work. This is tiny font. I'm happy to share the slides, but this just gives some of the sites for some of the things I've talked about. So thank you so much. This was a lot of fun, and I look forward to more conversation. And now questions, I guess.
Yes, thank you so much, Liz, for this wonderful presentation. So we'll take questions. We'll have to manage 3 mediums. So first, because you showed up, the audience gets to ask. So Dave is going to run around so that your questions are captured in our video recording. But this was just fabulous, Liz. Thank you so much for those words of wisdom, and also tying it back and reflecting on Rod's work and the profound contributions that both of you have made to our profession. So questions, please raise your hand. I have one question, and then maybe if I start, then others will warm up. Is why, particularly for COVID-19, why do we still not have good characterization? This is the largest slate of natural experiments that have gone on, and we have all of these methods of matching and synthetic control. Why don't we have quantification of intervention effects? And one thing, for example, travel bans. You see so many arguments about this, but we have seen, why don't we have, why do you think we don't have it? And also, in your school study, one thing I noticed was very curious was that the student masking did not have an effect, but teacher masking did. Why do you think that is? Because all of these things are rolled out as a bundle. Mm-hmm. So how do you really tease apart the effect of one versus other? That's my question. And also, why do we not have some more quantified, like what works?
I wish I had great answers for either of those. I think in some ways the two are related, because I think in part we don't have great information on what works because everything is so messy and sort of, yes, things were going into place sort of all together, right? Most places, I think there were some school districts that had teacher masking and not student masking. I doubt there were any. I hope there weren't any that went the other way. There are some papers. So if you go to the National Bureau of Economic Research Working Papers series, there are papers coming out on various policy evaluations of stay-at-home orders. I don't know if I've seen travel bans. And, it's hard to know what to make of them, though, because it is so, partly we don't have great data on the exposures. And even, I have a different paper that I didn't mention, where we compared so there are some sources of data on school policies that sort of say what were school districts doing as a sort of district level policy. But it's not super systematic. The data is not super systematic. Or maybe we have it for a few states, but not national. Or it's like people who were scraping web pages of school districts, so it's hard to know. It turns out we did do a comparison of our household-based measure with a couple of the sort of district-based measures, and actually it turned out they were more consistent than I thought. As expected, our rates were lower for in-person schooling, were lower than implied because of this point that families could opt out. So it sort of made sense. So I think that we're starting, I think there's pieces, but I think that we don't have great measures, and then it's just so hard to disentangle them because so much was happening. I think also it's, right now, the part of the problem is you could go and find one paper that shows, stay-at-home orders work, and another one that shows no, they don't. And we haven't yet sort of grappled with how to, communicate which of the studies we should trust, or how to sort of just even think through which one should we trust. And I think sort of taking that step back will be really important for us and for, again, sort of journalists. Actually, maybe I'll say one more word on this. One thing I got involved in during the pandemic was something called the Novel Coronavirus Research Compendium, NCRC, where we have set up a whole system at Hopkins to summarize preprints. And so basically publish a summary of we sort of had a process for picking which ones to cover, and sort of what does the study show, what are the strengths, what are the limitations, how does it fit into an existing research base. And I think we need more of that sort of entity. That has been mostly focused so far on more of the epi and sort of treatments or vaccines treatments, less on these policies, but I think that we could maybe start doing more of that.
Thank you. Rod. Oh, Kathy, please, go ahead. Yeah.
Okay. Just a quickie. First of all, great talk. A lot of really important and interesting things for us to think about. But one of the things that really strikes me about your talk is talking about the issue about design. Because I think that there's a tremendous emphasis in our curricula to talk about analyses.
Yes.
And I've seen it even with brand new PhDs that are coming in. And so there's it's always kind of like this art, and you'll learn it through experience. But do you feel like that we do adequate teaching in our graduate programs, experimental design, quasi-experimental design, non-experimental design? Because a lot of what I learned was actually like in epidemiology more than in statistics.
I'm so glad you asked that, and I would say no. I don't think that we do a good job teaching this. And again, it's partly, though, I think if anything, Michigan is almost among the better placed places and might do a better job, because like Hopkins, we don't even have a class on survey. We have a class on in a different department, not in biostat. There's a class on sort of surveys, but it's not, it's sort of more like questionnaire design. And it's a whole thing. It's not, there's nothing on experimental design. And I think, I'm hoping that actually the pandemic might help prompt more interest in these things as we realize that clinical trials can be really complicated and interesting, and we need to be creative about these platform trials and sort of clever designs to study different things. So I totally agree that I think we could do a much better job with that. Maybe there'll be progress in the next few years. I'm not sure. But I would love to see more design focus. And I think more broadly, helping think through where does data come from? We aren't, in statistics, I think we're better than some other fields. But I think in general, we need to kind of help people think that through.
So this is a wonderful talk. I really loved it, as I'll say later. But it's interesting you talk about COVID. That Michigan tried to get a funded survey, a random survey of COVID prevalence, and didn't get funded. And I think that's somewhat of a reflection of the fact that there's a tendency to throw off the sort of random sampling assumption. So whenever you see a statistics paper, they'll say, well, let's assume we have an IID sample from the population. Well, that's the most important assumption you're making, right? So,
yeah.
And in COVID, there's a lot of naturally, there's a lot of interest in these dynamic models for how the pandemic's spreading, but essentially no interest at all about where the data are actually coming from. Yeah. So, I really commend your emphasis on that, and I think it's sort of if you look back on your pedigree, right? So it comes back to Rubin and Rubin's 78 paper, where he really talks about this whole thing is laid out in Rubin's 78 paper. And then, of course, Rubin's advisor was Cochrane, who was, a real design guy. So, that you're part of a wonderful pedigree, I think, and hopefully you'll continue to spread it on with this wonderful talk and others.
Thank you. Yeah, I guess actually maybe I'll sort of respond to that and say, for the students listening, there is so much value in going back and reading some of those. I go back and I read some of these 1970s, Rubin and others' papers, and I'm like, gosh, they really, they laid it out back then, and we've sort of gotten away or forgotten, and you can learn so much from going back to some of those fundamentals.
Can I ask a question? So the econometrics field has a lot to say about causal inference, right? And they don't tend to use weighting and matching methods. They tend to be in love with other methods. And So I don't know, we have a sort of a thought on their approaches to these policy questions, and then also, do they care about populations very much? Do they have a sort of a concept of trying to deal with that as well? I'm just curious.
Yeah, it's a great question. So personal aside is that the spouse you saw in the pictures is an economist. He's a macroeconomist, so we don't really talk much about work. But and we have many economist friends from our time when we lived in Princeton, New Jersey together. And in grad school, I purposely took a microecon class to sort of understand. And so I've thought a lot about this, yeah, and I think partly they are just more comfortable with models. I think that they kind of tend, this is changing though a little bit, sort of, I think even like some of the newer differences sorts of designs, they are sort of coming from more of a design perspective, but they tend to have just been more comfortable with models and parametric assumptions than I have been trained to be. They are certainly interested in causality. I think they are better than we are at some elements of creativity in terms of looking for, they are very good at identifying natural experiments. And actually today we've talked a couple times about the Nobel. It went to Guido Inmans and Josh Angrist and David Card. And I think Guido and Josh are a nice example of sort of a slightly new way of thinking in economics, of sort of more focus on design. And honestly, I think they should answer this question, but they worked a lot with Don Rubin. And I think that sort of some of these principles of design and careful thought about who are we estimating effects for and what are the assumptions actually might have some overlap with statistics. So maybe not a full answer to your question, but that's sort of, again, I think fundamentally they're more comfortable with models than I at least was trained to be. Yeah, so I think instrumental variables can be an incredibly useful approach when you have a valid instrument. And I think, though, we just have to be, back to my point, like I think we need to be upfront about the assumptions underlying any approach. And like I teach propensity scores, and I teach instrumental variables, and I teach regression discontinuity and differences. And my main goal in the teaching is to help students understand the assumptions so that they can then think through in any given study, is it plausible? And I really try to avoid orderings of research methods where some people, including like the Department of Education, has sort of a listing of like, experiment is better than this, like it's like experiment, regression discontinuity, IV, propensity scores, and that really bristles because I really think you really have to just think it through in any given study.
Can I ask a question? Yes. Yeah, thanks for a wonderful talk. And I have two questions. The first one is you're talking about the sample size. We only have 50 states. I wonder if you ever consider like analyzing data on the county level. We have over 3,000 counties in the state, and different counties may have different, compliance of the policy.
Yeah.
And we studied like graduate driver's licensing, this sort of the legislation to restrict the young drivers, across different states, and you can see that there are different levels of compliance of the policy, and so. Even for the vaccine, right? Different counties may have different level of the compliance of vaccination. Do you have any comments on how this heterogeneities across different counties, even under the same policy, would help you to increase the sample size then, or do a better analysis of the policy efficacy? That's the first question. The second one is that talking about design, we're a lot of time talking about internal validation, as you mentioned. That's very interesting sort of terminology. I first time heard this internal validation. It's very interesting. What we're going to make a design for prediction? I think a lot of times we're looking prognosis rather than just looking at the treatment effect. Mm-hmm. So do you have any ideas or thought about how do we change our design for you to engage with some prediction?
Yeah.
Because I think that nowadays prediction becomes so important because we want to see what's going to happen about this vaccine, right? So in next, can we deal with the pandemic effectively in the next few months? What's going to happen? Yeah. Thank you.
So literally yesterday, I had meetings on exactly those two topics. So yes, I'm thinking about both. So the county point is, so I think so for some questions, we don't have that. Like the gun stuff, the policy is just at a state level, and so it's that's the unit of assignment. And we don't have good data on, say, homicides at a lower level. So sometimes we're sort of stuck. In cases, though, where we do have data at a lower level, yes, I think we certainly should try to take advantage of it, whether it's looking at sort of different levels of implementation, which is one of my meetings yesterday, but again, sort of if the catch is from a design perspective, if the intervention is really just at the state level, it's not clear what added value lower levels of data will be because you have the treatment at the state level. But again, if you have variation in implementation underneath that and outcomes measured, it certainly makes sense to use that. But again, I think that's something that people haven't thought too much about yet. I mean, it kind of makes sense, it's sort of obvious, but there aren't many examples. I'll try to be quick on the second one. Oh my gosh, which now I'm forgetting. Oh, prediction. Yes, so actually, I'm literally working on a grant right now where we're trying to sort of think through what are the implications of different sort of data design samples for prediction. I personally have done very little prediction work, so I'm going outside my core comfort area. But I do think that there's going to be some similarities and something that we can learn from this. So check back in a year, and I might have more to say on that.
Other questions? Is there any question, Carrie, on YouTube or Zoom? I have to share one comment on YouTube from your student, Trang, and the comment is, "She changed my life." So I had to share that, though it's not a question, but this is very important to conclude on that note, that the impact that we make through our research, but also to our students and our mentees and changing their lives. So we did not do a very good job with prediction design because Michigan cases are rising at the time of our talk. And also Omicron, we did not predict it either. So I do not know, but still Liz is here. We are very, very thankful. And I want to thank all of you for coming together here to celebrate Rod and Liz. Now is the time for Rod to present the award plaque to Liz and for us to pose for that photo that is going to go on to the 2022 talk slides, and Rod to make some few
Good thing
remarks
we got this
as well.
In 2021, right?
Yeah.
Are you in the picture too, Bruno?
Yeah, why don't you come and
No, okay.
come.
And then I'll come. Yeah. Here is our photographer. So.
Who's taking the picture? Oh.
Thank you.
That's yours.
Thank
Okay,
you.
you take it.
I'll take it.
So I'm certainly not going to stop people from going to happy hours, and so I don't have a whole lot to say except that I don't know. Liz says that it was a great honor for her to be giving this lecture, but from my point of view, I think it's really a great honor that she was the lecturer, since I was totally bowled over by the talk. For many, many different reasons. Of course, I have a lot of shared interests. I'm very interested in causal inference and, working with Don, obviously, that's a big connection. And also, my first days at World Fertility Survey was doing probability sampling, and as sort of came out in the discussion, I think this that aspect of statistics, there's a danger that gets neglected. The idea of probability sampling is one of the major contributions of statistics to finding stuff out. And also when I was a kid, when I was a student, there was very little talk of causal inference in the statistics world, but my, how that's changed. Now we really have so much to say, I think, in terms of doing causal inference. So I love the topics, and I also love the general theme of just how much we as statisticians can contribute to the world's problems these days. I mean, God, with the lack of interest in science, we need statisticians who are not bound up in the politics of the process, are really interested in just trying to get the right answer. Don't we need that more than ever these days? So just a wonderful talk, Liz. Thank you so much, and it's great to have you here, and thank you all for coming as well.
So as Rod mentioned, that you have a reception outside, a strolling reception with food and beverages. It's a big space, so let us proceed to that reception. But before that, one more time, this is a very special moment. I even forgot that these beautiful spaces existed in University of Michigan campus. They were waiting for such a moment like this for 2 years. So thank you for being a part of this moment, and thank you for being part of this journey. On behalf of University of Michigan School of Public Health and Department of Biostatistics, thank you all for who joined virtually, and really let us celebrate this moment and take it outside. There is no Zoom delivery for food, so you're missing out. And I'd like to thank the Michigan Biostatistics staff one more time, amazing, and also our caterers, Movable Feast, who need some advertisement because we have to support them as well. So thanks everybody, and have a wonderful evening.